Ryan are both joining us from Drayer Physical Therapy. We talked about them earlier, that they are one of the sponsors of the event, so let's thank them for that. And so Nicole, she has been helping our community as a doctor of physical therapy since her graduation from Duquesne in 2018. She's also an adjunct faculty at Seton Hill University and Duquesne University, and help lead the next generation of those who work within our communities. Ryan has worked with physical therapy in Wexford, in the Drayer Physical Therapy location in Wexford since 2021. He graduated from Shenandoah University in Winchester, Virginia, where he got his bachelor's in exercise science and his doctorate in physical therapy. So again, they're both here from Drayer, and they're going to talk through some of their stuff today. So welcome them.
Hello. Hi, everybody. Thank you for such a warm welcome. So, as Lara said, we are with Drayer Physical Therapy. And has anyone heard of Drayer Physical Therapy or been to Drayer Physical Therapy? Yes. Yes. Heard. Wonderful. Okay. For those of you who don't know us, we are the overall family of Upstream Rehabilitation. So Wexford is actually our initial location. 17 years ago. If anyone has been to Drayer, you will recognize my former office coordinator who just retired last year, but she's been with us for the entire length of time here. Wexford was our original, and then over the last 5 years, we have expanded to 12 clinics in the Pittsburgh area, all ranging from north, south, east, and west, based on where you live. Ryan is passing out some pamphlets, not only of our locations, if you are interested, but also some information about how we treat arthritis in the various forms. Okay? But today we are going to talk about the power of movement as it relates to arthritis. Let's see this. All right, so everybody in here probably has a diagnosis, correct? And I would not know that just looking at you, because arthritis affects all ages, all backgrounds, all lifestyles. We may be familiar with two of these individuals up here, Jack Benny and Dick Van Dyke, both of which battled with arthritis. We all can understand, having the diagnosis, that it can be invisible to the external world, to our family members, to our friends, the pain that we're experiencing, the difficulty that we're going through. Maybe if they're even just asking us to go for a walk in the park or go to the zoo with a grandchild, that might trigger, okay, I'm going to be in a lot of pain. So two individuals that I did not know dealt with arthritis, but in particular, Jack Benny kind of struck me that when he was receiving one of his Golden Globe awards, he, in his speech, talked about, I don't deserve this award, but I also don't deserve arthritis, and neither do any of you. So just driving home that point that it really does not, it doesn't matter. It affects all ages, backgrounds, and lifestyles, just as I see in this room, all ages, lifestyles, and backgrounds. Okay? I kind of alluded to this a little bit early, but we are part of the Upstream Rehabilitation family. Both Ryan and I are team members that are currently practicing, so we have stepped away from our clinics to talk to all of you about arthritis and what physical therapy can do to help. There is a lot that we can do in multiple stages. So that is the goal, and the objective by the end of today is to give you some hope, give you a path, give you somewhere to start if you are feeling like I'm lost. Okay? Alrighty. And Ryan is going to get us kicked off.
Thank you. Hello, my name is Ryan. Nicole and Laura both gave me a little bit of an intro. I am a physical therapist with Drayer Physical Therapy, and I have been part of Nicole's team since about 2021 when I graduated from Shenandoah University with my doctorate in physical therapy. As a physical therapist, it is my passion to help people in our community move better and feel good while doing so. And I'm really excited to do a little bit of movement with you all today. So kind of to get us started and wake everybody up a little before lunch here, a wise individual named Albert Einstein once said that nothing happens until something moves. Well, today we're going to be that something, and we're all going to do a little bit of movement together. So at this time, if you're comfortable standing up and you can do so safely and without too much pain, I'm going to ask everybody in the room to stand, and we're going to run through a few quick exercises together. Woo! Yeah, we're gonna burn some calories before lunch here. So the first thing we're gonna do, as you can see on the far end of the screen there, is going to be a march. We can do this standing or sitting. Great exercise for your core, your hips, and for balance. So on the count of 3, we're all gonna do 10 marches and we're gonna count them out loud together. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Woo! Well done. Yes, great job holding on to the table. Our second exercise is a calf raise. These are awesome for building calf strength and preventing blood clots from developing in our calves. These can also be done standing or sitting. We're gonna go up onto the balls of the feet and lift both heels up off the floor. And we are gonna do 10 together on the count of 3. 1, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I see more safety down there. Love it. All right. Last exercise here closest to us. If you have ever been to a sporting event, you may have seen the wave. So we're going to start on this end of the room and work our way down. We're going to get our shoulders loose. So when I say 3, this end of the room is going to lift. And then we're going to gradually work our way down to the other end of the room and work our way back. So over here, 1, 2, 3, lift. And we're going down the room. Everybody's doing it. Woo! And down. And we're back up on this side of the room and everybody's going the other way. Woo! Okay, great job, everybody. All right, you guys can all have a seat. All right, now we got the blood going a little bit. Those are like at least 5 calories now that you can eat extra in like lunch or pastries back there. So now that we got everybody moving a little bit, let's get to kind of the meat and potatoes of things. Some of this will probably be review from other presenters this morning. But before we get into how is physical therapy going to help with my arthritis, let's lay the groundwork a little bit for what is arthritis and how do we kind of look at that from an anatomy standpoint and approach that as a physical therapist. So essentially, let's talk about what and the why of arthritis are before we can talk about how physical therapy is going to be able to help. So what arthritis is the degeneration of cartilage that cushions our joint surfaces. And cartilage is essentially a nice squishy tissue that lines our bones and our joints, and it helps with the compressive forces when we're moving throughout the day. And when we get degeneration of that cartilage, it can lead to things like pain and inflammation, and it can obviously make some of our functional movements throughout the day a lot more difficult. So what we have depicted here in the picture is the 2 kind of main brands, we'll say, of arthritis. So arthritis tends to fall under either an autoimmune form of arthritis, which would be something like rheumatoid arthritis, or a more age-related, normal degenerative form of arthritis, which we call osteoarthritis. As you can see on the picture on your left side of the screen, with the rheumatoid arthritis, there are extra immune cells that are essentially rogue cells that come into the joint and attack that cartilage and cause that inflammation and degeneration. With osteoarthritis on your right side of the screen here, there aren't nearly as many cells and as much going on in that picture because that is more cartilage degeneration from normal wear and tear over time. Go ahead to the next one. And so what contributes to developing one form of arthritis versus another? So our autoimmune forms of arthritis, like rheumatoid arthritis, generally are going to be thought to be caused more by genetic factors in an individual, and then different types of environmental triggers or stimuli that might bring on that type of a reaction within our body. Our osteoarthritis, or our normal age-related arthritis, number 1 is associated with aging, and as we age, what we see is changes in our cells within the joint and how those cells are able to maintain a healthy and happy environment within the joint. Some things that can contribute to earlier onset of arthritis as we age would be things like obesity, which we just talked about, it sounded like in the last presentation. More weight is going to cause more stress on some of our load-bearing joints like our hips and our knees. a repetitive mechanical stress. So this could be what job you worked, what hobbies you performed, if you were consistently or repetitively putting a certain stress on your joint, and then any previous injury. So if we think about a knee, any type of fracture, ACL tear, meniscus tear, those things have been shown in the research to increase the risk of developing arthritis a little bit earlier. So now that we've laid the groundwork for what arthritis is and why arthritis happens, let's kind of get into the good stuff of how is physical therapy going to help. So motion is lotion. This is probably a saying that most of us in this room have heard at some point. If not, we're going to harp on it a little bit today. So motion is lotion is a really fun thing to say because it rhymes. But the coolest thing about motion is lotion is that there's some really awesome science behind the saying. So our joints are lined with a membrane called the synovial membrane. And when we move our joints, what we do is we cause compression and decompression of that membrane. And when we compress and decompress the membrane, it actually secretes something called synovial fluid into our joints. And that synovial fluid acts like grease to help oil our joints, and it is a lubricant so that there's not as much wear and tear on our cartilage that we talked about earlier. So this kind of theory can be really closely tied into something that we may have experienced before, which is individuals with arthritis tend to wake up in the morning feeling very stiff and a little more sore and painful. But as you start to do a little bit of light movement in the earlier part of the morning, by midday, some of your joints can start to feel a little bit better. That is explained by motion is lotion, because when you are sleeping, your joints aren't getting that nice movement, but when you start to move, all of a sudden your joints get lubricated, they get greased up, and then movement gets a lot easier and you start to feel a lot better. So this motion is lotion concept with our joints having this synovial fluid that gets secreted when we move them is kind of the whole foundational concept of why physical therapy and why physical activity like exercise in general is beneficial for individuals with arthritis and good for maintaining a happy environment within our joints.
All right, so what will we do? How are we going to help? So most of us, including Ryan and myself, if we went under imaging, we may find arthritis, we may not find arthritis. It may be the cause of our pain, it may not be the cause of our pain. So just because you do have a diagnosis of arthritis or you're having pain in a joint that you don't yet have a diagnosis of arthritis does not mean that there is no hope and you should be writing it off as, okay, well, I just was diagnosed with Arthur, so it is what it is. That is where we step into play. What are the things that we can do to help you be able to exercise in a way that you want to help you be able to perform your activities without pain, without fear of falling, without knowing that by the end of the day you're down for the count and you're going to have to sit on ice for 15 minutes. Okay? So PT is going to focus on looking at the mechanics of how your body moves. We're going to look at, are there asymmetries in your muscle activation? Are we getting all the muscles around a joint to help properly support it? So as Ryan talked about, you have synovial fluid that's released with movement. However, we also need our muscles to be able to support our joints. If some muscles are doing more work while others are not, that's going to put abnormal force through one portion of the joint, which encourages the degeneration and the breakdown of that cartilage in the joint. So we look at it from a mechanical standpoint. As movements of expert, we're looking to see where is the symmetry of both sides and all of our muscles in relation to that joint. So your muscles help brace your joints. And then we have balance. So balance is going to reduce the risk of falls. It's going to improve the longevity of your functional independence. So what will PT do for you? Good physical therapy. So although we are here and we'd love you to come see us, we want you to go somewhere that you are going to be consistent and compliant with the program. So what should a good physical therapy program look like? It should always encourage hands-on treatment. Hands-on is the thing that you cannot redo on your own. You can't replicate on your own at home. So always hands-on treatment at every appointment. And the goal will be to improve the mobility of your joint. If your joint is restricted, let's take, for example, the shoulder. You have arthritis in your shoulder and now you can't reach over your eye height to get to something on the top shelf, whether it be a medication or a dish or something in the pantry. Our job is every time working on that shoulder to improve the range of motion so you can actually reach further. Strength, we talked about how muscles help offload and properly support the joint. Identifying that asymmetry and properly prescribing a strength program to reduce the repetitive stress of our daily activities. Endurance, so it's not just enough for me to test your strength and say you're 5 out of 5, good. You've got to be able to do that motion every day, all day, multiple times a day. Let's take something outside of the shoulder and think about a squat. How many of you think you squat a lot throughout the day? Outside of an exercise program. Yeah, okay. When all of you go to stand up, get lunch, and come back down and sit down, you're squatting. Think of how many times you stand and sit in your day. That's the first thing you do to get out of bed is stand and sit. So every day we're squatting. We have to properly improve the endurance of our muscles, the strength endurance of our muscles, if we're going to ask them to help support us long term. We talked about balance, reducing the risk of falls, decreases your risk of injury. We already established that with injury comes a higher onset of arthritis. So let's just minimize that as much as we can. And then if necessary, there comes a point in time, as we heard in the earlier presentation, where you're doing everything you can and needs a little bit of assistance, whether that be an assistive device or surgery. That's where we also come into play. All physical therapists are trained in providing, measuring, and assisting in the use of assistive devices, whether that be a cane, a walker, maybe it's an orthotic, maybe it's a different shoe, or an AFO if anyone has heard or currently uses one of those. All aspects of assistive device training that we are capable, and you should seek a physical therapist to help guide that transition in use. Okay? And last but not least, home exercise program. Home exercise program is key. It's what you are going to be doing in the long term when you leave our doors that's going to keep you from coming back through our doors. Okay? All right, so what? We said all this, now what do I do? I want everyone to look at this, and I think most everybody has paper and pen. So I want you in each category, low impact, group classes, functional strength, and functional balance. Pick one, write down one of these forms of exercises that interest you, that you would want to do, that you want to get back to, or you want to continue doing without pain. A good program, physical therapy and home exercise program, should incorporate one from each of these categories. We want that low impact because we don't want too much stress going through our joints. Cardiovascular. That cardiovascular is going to help improve that muscle endurance. Group classes. I don't like exercising on my own, which is why I don't do it. So doing it in a group setting may be most beneficial for you and helps create that community of other people that might be experiencing similar pain or going through something more difficult with you. Functional strength. No cookie cutter exercises sitting there kicking your legs out. That's not super functional in the long term. We might need it to start, but long term we should be doing things that encourage the motion of what you're doing day to day. So what we mean by squatting, I told you, with sitting to standing out of a chair. Lifting and carrying. How many times do you bend down to get something out of the dishwasher, or bend down to get something out of the washer or dryer? Those are considered lifting and carrying. Pushing and pulling. All of you are going to leave this room and you're going to push and pull a door. All of those functional activities should be a repetitive motion that you can do without pain. And then last but not least, functional balance. I love this one, especially when I tell people to stand on one leg. They're like, I don't do that. You do that every day. You do that when you stand to get shoes and socks and pants on. You do that when you take a step to go up the curb, when you get out of the car or stand to get into the car. You one leg, get in and out. So it's not a matter of, can I stand on one leg for 30 seconds because I do that all day? No. Can you stand on one leg without pain because you're going to do it 500 times throughout your day? Does that make sense? Awesome. what to do when it hurts.
So now that we talked about a little bit of different forms of exercise that we can participate in, and hopefully everybody has something in mind that they're thinking about maybe starting or getting into, we also need to talk about knowing when to stop and when to protect ourselves. So if you are not somebody who's been exercising, it's always a good idea to check in with your PCP first and get screened by your general healthcare provider to make sure you are a safe candidate to start exercising in the first place. And then as far as what we have on the screen here, we're going to break these into two essentially what we would call yellow flags and red flags. So our yellow flags are the things that tell us to slow down and listen to our body. So this would be you're starting a new exercise, you are getting really sharp pain, you're getting pain that is getting worse the longer that you do an activity, or after you're done with the activity for like 3 or 4 days after, you are really, really hurting. Those aren't necessarily signs that you shouldn't be exercising, but they might be signs that you either need to try a different form of exercise or that you need to seek out the guidance from a qualified healthcare provider who can help you kind of tailor your exercises to yourself, whether that's a physical therapist or a personal trainer or some other qualified instructor of like a group class like Nicole mentioned before. And then the red flag signs, these are things that should cause you to stop exercising immediately, potentially to go to an emergency room and get screened. And these would be things like chest pain, lightheadedness, fainting, excessive shortness of breath to the point where you feel like you can't catch your breath. And these are all signs that there could be a bigger problem, say with our cardiovascular system, which is something that we do not want to play around with. So kind of getting towards the end of the presentation here, we want to touch on something that's a little bit of a newer concept in the world of physical therapy and healthcare, and this is prehabilitation. So prehabilitation or prehab is essentially exactly what it sounds like. It's an episode of physical therapy care that's going to happen prior to undergoing some type of surgical intervention, such as a shoulder replacement, hip replacement, knee replacement. And prehab can occur in two kind of very different and distinct pathways. So the first pathway would be you and your doctor have already decided together, your surgeon, that you are getting a knee replacement. It is going to happen. And so you as a team decide, let's do about a month of physical therapy treatment leading up to the surgery in order to prepare my body for the stress of surgery that it's about to go through and help it better recover after the fact. The other way that prehab can occur would be you're not quite set on a surgery yet. You have pain in your joint, your doctor has diagnosed you with arthritis potentially, but you're trying to either avoid or delay having to have a surgical procedure done. Your doctor sends you to a physical therapist to do what would be more traditionally called rehab, and we're going to take you through the hands-on treatment and a lot of the exercises and things that Nicole had touched on earlier. And unfortunately, physical therapy is not always 100% effective. We would love to be miracle workers and say that we could fix 100% of the people that walk through our door. It doesn't always work out that way, unfortunately. Almost everybody that walks in the door makes improvements, but if you have very specific goals and we're not able to get you to those goals, then you and your doctor may still end up, after doing your physical therapy, electing to undergo some type of surgical procedure. The good news is, if you do physical therapy first and it fails and you end up getting a surgery after the fact, you have just done prehab and you have just prepared your body to undergo the stresses of the surgery you're about to do. And some of the early research that we're getting on prehab in individuals who participate in this kind of a program are showing some really spectacular things. So it's pretty well established at this point that the more physically fit you are going into the surgery, the better your outcomes are going to be coming out of the surgery. And that's going to be decreasing the complications you experience after surgery, decreasing the amount of time, if at all, that you have to stay in the hospital after surgery. It is going to decrease the level of pain that you experience following surgery and improve your functional ability and strength. So by doing a round of prehabilitation, it's always good to try physical therapy before you elect to move forward with any type of permanent surgical procedure, unless there's a very specific reason that your doctor would want you to avoid that for other health concerns potentially.
So last but not least, finishing it out, how can we start now? There is a program, if some of you don't know, called Silver Sneakers that allows you to utilize that program to go to many different locations to use their equipment for exercise. I think the YMCA is part of it. I know my Drayer Wexford location is also part of it. So that is an avenue. Also, reaching out to your community centers, especially for group classes. Community centers in specific, we found a lot with Cranberry, Butler, Pine. There's a variety of different group classes for a variety of different styles of exercise and age ranges that I would encourage you to get into, okay? And then last but not least, community walks. You're all here. You're all a part of the Arthritis Foundation. They do a wonderful community walk, the Walk to Cure Arthritis, May 17th. So if any of you enjoy walking and that's something you want to work towards, let's start now. Start working towards being able to participate in that walk now. And if that means you need to seek out physical therapy in order to fine-tune some pains that we're having, come through our doors, okay? But thank you all for your time. If anyone would like to speak to Ryan and I separately about any issues that you are having or any questions or fears about physical therapy, please do not hesitate to reach out to us. But we wish you all a wonderful day. Anybody have questions for the group? Home program is going to be the key to longevity of why we do what we do. So with the home program, your physical therapist on your last day, your discharge, your graduation day, woohoo, you made it through. You should receive an updated home exercise program with a detail of, I want you to go through this. And usually Ryan and I practice in this way. These are the exercises you're going to do 3 times a week, just like you were doing with us, 3 times a week for the next month. And then I want you to transition to here. Something else to note, if your home exercise program becomes painful, maybe it's too easy, maybe it's not painful, you don't have any difficulty with it, you don't feel like you're getting anything out of it, go back to your physical therapist that prescribed it. They should be able to do an assessment, do a rescreen or evaluation to update it for you or make the necessary changes if it is creating pain all of a sudden. Good question. Yes. Yes. Yes, so depending on your insurance, at least I can speak for our clinics, we, as a courtesy, verify everybody's benefits before they walk through the door. And on that very first visit, we review what your benefits are and what physical therapy looks like being covered for insurance. So yes, and if the physical therapist that you are going to does not do that, I would encourage you to ask so there are no surprises. Yes. Yes. So if you do your physical therapy, you got discharged, you graduated, you have your home program, you decide, nope, I'm not going to do this. Yes, you can come back. Insurance doesn't say, no, you've already been here once. You can't do it again. Now, I'm not going to get into the nitty-gritty details of everyone's individual plan because everyone's plan is different. Some people have hard caps where your insurance does not let you be seen beyond a certain number of visits because that is your plan. Most insurances work on medical necessity, and that is where the physical therapist and their documentation, that's the whole reason we need to evaluate you, is to identify the individual aspects that set you apart and why you need physical therapy. We document that, send it to an insurance company, and get authorization for more visits. Yes. Now, let's say you didn't follow your home program, like you should, but you have these goals that you want to get back to, and it doesn't really require physical therapy. It just requires you to move, to do the appropriate exercises. That's where your community engagement, going to your community centers and getting involved in a group exercise program can be helpful. We also offer a wellness program where you can come as many times as you want or as few times as you want in a month. You can utilize the equipment in the clinic and you can ask the questions to the physical therapist, especially those one-offs where, hey, I'm not feeling so good today. How should I adjust my program today? So those are other options that are available, is a wellness program. It is very underutilized, let me tell you that. But I really enjoy the morning breakfast club of wellness patients that come in, have their morning coffee and donuts, and get to work, ask me questions, create a community, and then have a great day afterward. So it is $35. You come as much or as little as you want. 1 month. Yep, so that is 30 days. Something to note with that, whatever day you start, it's 30 days after that. So you could have started March 28th, and it's not like, okay, April 1st hits, I got to pay another fee. No. One time, 30 days, and then each time you come on that 30-day renewal, we ask for your payment. Any other questions? One thing I will note with our wellness program, and this is just good practice in my clinics, we will establish care first. So if we have never seen you before, we are not just going to let you come in for a wellness program. We want to make sure that you have the appropriate program of exercises, progressions, whether maybe you're using ice or heat with us, we're using the appropriate things. That comes from an evaluation. So we will do an evaluation just to establish the care and make sure you have the right program delivered by us. And then you can transition to wellness. Depends on your insurance. So if you have a federal insurance, great question. If you have a federal insurance like Medicare, then you do. It is required by Medicare that you receive a prescription to come to physical therapy. If you have a commercial insurance or a MAP plan, then you do not need a script to come to physical therapy. And all of my locations have what Ryan and I are direct access clinicians. So we are able to evaluate you for 30 days without a prescription. In good practice, we will reach out to your provider, whether that be your orthopedic, your surgeon, or your PCP, to let them know, hey, we saw Edward, we did this evaluation, here's the update. Keep everybody on the same page because it's a team collaboration. So it's in your best interest if everybody knows what's going on and what we're doing. That is direct access, yes. $30 days, yes. I could see you for 30 days. That's why we send it on the first day, though, so you don't have that hiccup. You're not at 28 days, and you're like, oh, I got to get that prescription from my doctor. We do. Yes, so we do multiple body parts as well. You don't need to just come for one and say, I'll come in 3 months when I'm done with this one for the other. Multiple body parts, because our body works like a chain. It all works together. So 9 times out of 10, if we're treating you for your low back, but you also have neck pain, we're going to find out, and we're going to have to include it into the program, okay? You guys are asking excellent questions. I really don't want to interrupt your lunch, so please, if anybody has more questions, come see Ryan and myself. We are happy. We'll be here for a little bit longer and answer your questions. But thank you all for your time and attention.